Good afternoon. My name is Lori Zabata, and I'm a proud JWU alumna and the Director of Alumni Relations at Johnson & Wales University. Thank you for joining us for today's session, Food Safety, a Q&A session with Bridget Sweet. We're excited to have her synthesize this important information for you in a digestible way, and we hope it will assist in clarifying some of these guidelines. Before we get started, I'd like to review a few housekeeping items. If you have a question for Bridget, please add it to the Q&A section at the bottom of your screen. These questions will be asked after a brief presentation. The chat feature can be used to message other attendees privately or publicly. This section is located also at the bottom of your screen. I'd like to thank the Alumni Relations team for their help behind the scenes of today's session, especially Liza Gentile, Assistant Director of Alumni Relations and proud JWU alumna, for her work to bring this program to us. Thank you. I'd like to introduce today's moderator, Bridget Sweet, Executive Director of Food Safety at Johnson & Wales University. Bridget is based in Providence, Rhode Island, but has responsibilities for all 4 of JWU's campuses. She's an active participant in Rhode Island's developing food strategy and an advocate for reliable and relevant food safety education and practices. Bridget is also an active member of the Conference for Food Protection, where she serves on a variety of work groups and council too. Bridget has a broad background in food safety that includes regulatory, industry, and higher education experience. She has served as a food inspector for the city of Taunton, Massachusetts, environmental public health officer at Harvard University, public health administrator for the town of Sharon, Massachusetts, and as global food safety specialist for Whole Foods Northeast and North Atlantic regions. She is currently pursuing a doctorate in law and policy at Northeastern University and holds a master's degree in food safety from Michigan State University, as well as a bachelor's degree in marine safety and environmental protection from the Massachusetts Maritime Academy. She's a resident of Franklin, Massachusetts, where she serves as the chair of the Board of Health. Thank you for leading today's discussion, Bridget. We appreciate you giving of your time today, and I'll turn it over to you.
Thanks, Lori. Thanks, Liza. Hi, everyone. Thanks for joining. Really, the goal of this is to really support you all with your questions as they relate to COVID and food safety. So I don't have a lengthy presentation ready for you because really this is about your questions and how we can best support you in your current endeavors. But I did want to bring your attention to, or not, really just the overall landscape of food safety within the COVID realm, if you will. So post-COVID and how food safety sort of is intersecting with our food safety requirements. And the reminder that no matter where you're located, you want to ensure that you're following with all of your local health departments regulations, as well as your state or county health department. And depending on where you're located geographically, that can really vary. So just be really mindful and cognizant of that as you're looking for reopening materials or continuing operational materials. Make sure you're referencing your local resources first, because that will have the most significant impact on your operation. And also the reminder that as challenging as post-pandemic food service is, food service in general is uniquely suited to handle a lot of the challenges related to COVID. You're all certified food protection managers. You're already well aware of how important hand hygiene is, how important it is to stay out of work when you're ill. And then of course, your frequent cleaning and sanitizing. So these extra steps are obviously a burden to your workplace, but you're already well suited and prepared for a lot of these challenges with your routine operational planning. So again, just reminding everyone that with your certified food protection manager that you are pretty well suited to handle some of these tasks. And as questions arise, please do put them in the chat box. A reminder of the FDA and their infrastructure in relation to food safety. So they'll be doing a lot of overview for supplying management programs. But again, your local and state health departments are going to be the driving factor for you as you resume your operations. The CDC has a wealth of resources as they relate to your operational planning, but also on how best to support your business if you have either a COVID positive employee who has worked and has created a contact tracing protocol, or if you've had a guest who has reported to you that they've also had COVID symptoms. So the CDC has relevant and timely information to help support you as you transition through this post-COVID food service era. Also be mindful of the different gathering requirements depending on where you're located. So currently in Rhode Island, social gatherings are reduced to 10 people, and food service and alcohol service must stop by 9:30 or 10 o'clock, depending on where you're located. And that would not be a CDC recommendation. That would be, again, a state or a local health department recommendation based on science from the CDC. And then I wanted to share with you all, I'm sure you're all familiar with the National Restaurant Association, but I also wanted to bring to your attention the Conference for Food Protection and another organization called the Association of Food and Drug Officials. These two are both regulatory based groupings, but they have a wealth of resources as well for you as you return or continue your operation in this post-COVID era. So there are a lot of resources available. The challenge that we're finding, not just in Providence or in the Northeast, is that there's so much information out there. It's just not easily accessible. So really the point of today was to put a lot of these links together for you all for future reference so that you can go into these specific websites and really be able to access a lot of the information that you may need. So on this bottom here, afdo.org, coronavirus resources, there is a wealth of information as to how you can operate safely, how to do contact tracing. There's a lot of case-specific resources for different states or municipalities. And the benefit of using something like the AFDO page is because this is the same resource that a lot of your regulators are using. So you're all speaking the same language all the time. And again, all this information is updated continuously, which is obviously really helpful. Again, just some additional links and resources. As we've returned to food service, there was that erroneous report from the CDC that restaurants were super spreaders or increased the rate of COVID. Since then, that has been debunked. We know now that a lot of the transmission is through uncontrolled social settings. When you're in a restaurant and you're following all of your prescribed protocols, the risk of transmission is super low. So again, just additional resources for you all to reference in that landscape. And then really just, again, just a variety of resources for you all as you continue through your post-COVID response. I know that one of the questions that came through was related to buffet service and how that may change based on COVID protocols. And at this time, buffets are still really restricted. And I think it's really important to note that they're not restricted because we're afraid that COVID is spread through food. We know that that is not the case, but it's restricted because of the queuing up in that area. So at this time, I don't think buffets will ever come back the way we're used to. And that's just sort of my perception based on a lot of the regulatory calls that I've been on, but also because consumer bias. After 9 months of no buffets, people are leaning away from it. And I think people are always going to be a little bit less likely to access that buffet based on all of this, sudden restriction on these types of food service activities. So I think we'll see a decrease in overall buffet offerings, which makes my family very sad because I have 4 boys and their favorite restaurant is one of those Brazilian steakhouses where you can eat everything in sight. So they're sad. But again, it's more because of that queuing up, not because we're worried about food safety, but it's because of that close proximity of people as they're waiting for, really waiting their turn. We're not very good at that, as I'm sure you've noticed. Another question that came up through the chat right before we started was regarding obtaining a master's in food safety. I don't know if there was more specific information related to that question. Liza, was there anything more specific or just the general?
It was looking just for general advice.
Sure. So we're actually launching an online program here at Johnson & Wales, which I'm very excited about and worked really diligently with some of the program outline and support as we crafted that. I think it's a great avenue. I think obviously I'm biased because food safety is my career and has been for the past 10 years. But I've always told students here that I've taught in the past 3 years that culinarians are uniquely suited for food safety roles because they have such an intrinsic knowledge of food. And I can say that because I'm not a cook, I'm not a chef, I'm not a culinarian. As Lori mentioned, I went to Mass Maritime for environmental science, and I sort of fell into public health, which is how I became in food safety. I fell into it by accident and I love it, and I would never change anything about it. But for people who have a culinary background, I think it's such a unique perspective to look at different challenges in food safety. And I think you have a keen eye on how to correct a lot of those violations that you may not even have noticed off initially. So with your intuitive knowledge of the kitchen environment and of how food is prepared and why people do things, you see things a lot faster than a regular inspector with no food background. For a long time, my first 2 years in the field, I had to ask what every single piece of equipment was because I didn't know. I don't use it at home, and I certainly wasn't using it in a restaurant setting. So there's a unique advantage to culinarians taking a leap into food safety, and there are quite a few graduates from JWU who have become either regulatory inspectors or food safety inspectors for individual firms. So I think it's a great idea. If you have additional questions, whoever did ask that, you can reach out to me at any time and I'll help you as best I can. But I think all education is good. I think we should always continue to keep learning. I'm currently in a program, hopefully done next month, for my doctorate. So I think it's a great opportunity. And again, I can't stress enough how important culinarians are in the food safety realm because you have such a broad understanding of food, and it's just a great experience. So that's my 2-second highlight. So whatever other questions we have, please let me know.
If anyone has questions, you can just type them into the Q&A box at the bottom of your screen and we will take them from there. And also, we will make sure that you all get these links in the follow-up so you have them directly as well. Bridget, while we wait for some questions to come in, is there anything that has changed in guidance recently that folks should be aware of?
A lot of the guidance structure is really, depending on where you're located geographically, is really related to the social setting status. So it's not necessarily related to food service, but it has impacted food service drastically because a lot of municipalities or states have actually reduced the time an establishment can be open and crafted safer at home advisories. So for example, in Rhode Island and Massachusetts, there is a strong recommendation that you're home by 10 p.m. during the week and 10:30 on the weekends. And that is unfortunately impacting restaurants in such a terrible way because the spread is happening at home. The spread of this virus is happening in uncontrolled settings where people are with their friends and family and they just let their guard down. But whereas in a restaurant, people are making, good choices. All the employees are wearing facial coverings. A lot of establishments have very, very strict parameters before you can even enter. A lot of establishments are still doing temperature verification. So there's such a high level of focus in a restaurant setting, and it's not happening in the restaurants. But because of this other guidance about reducing your activity outside the home and only being out when you absolutely have to, it's just really impacted the restaurant community quite poorly. The question just came through, are there any new recommendations for washing fruits and vegetables that may have been handled by other consumers in a grocery store? This is actually a great question. And this comes up obviously before COVID. I think it's just much more heightened now because people are so uber aware of the viruses. But no, there's no additional recommendation at this time because when you purchase produce in a supermarket or a grocery store, it's considered a raw agricultural commodity. So the responsibility is, or the intention is, that it's not a ready-to-eat food and that the consumer should be washing that product when they get home, which obviously sort of seems counterintuitive because people don't always wash their produce, but it really is, there's no additional guidance at this time regarding that type of produce. There are challenges with obviously setting food up in a grocery store. I'm sure you've all seen the news report that came out about a year ago when there was a person actually drinking soup from the soup ladle inside a grocery store. And then a couple of years ago, there was an individual in Michigan who actually put rat poison on different produce sections in 5 different supermarkets. So always wash your produce unless it already comes washed. So don't rewash bagged lettuce because that's already been washed. And if you wash it again, you could recontaminate it. Another question came through that, oh, yay, enrolled in the JWU Master's Food Safety Program. How do I advise getting experience in the food safety field during this time? So I would encourage you to, Where are you located geographically? Can I ask that, Liza? Is that legal? Can I ask a question of someone who asked a question?
Yeah.
You're in Pennsylvania. Okay.
Pennsylvania.
I will share my contact information with everyone, but let's connect offline as well. But I would encourage you to review the codes in the area that you're located within Pennsylvania and see if there's any way you, once COVID dies down, if there's any way you can shadow a health inspector, or if there's any type of practicum. A lot of health departments have scholar programs or intern type programs where you can shadow or support a local health department, or even if you volunteered 6 to 8 hours, or just 6 hours at a time to go into that field. Become very, very aware. I would definitely access the AFTO website that's listed here, as well as the Conference for Food Protection. And then I would enroll myself in a variety of listservs that highlight and will demonstrate a lot of jobs in the food safety field. And looking at some of those job descriptions will help you narrow down what you may want to do. If you want to be in regulatory food safety as opposed to industry food safety, there are various tracks that you can take as well. The benefit of the master's program that you are enrolled in is that completion of those classes will allow you to take additional certifications. So upon completion of the program, you can be eligible to sit for a certified food protection specialist, or there's a variety of new credentials through NEHA. And I can put that link up and make that available as well. But the National Environmental Health Association offers a variety of credentials related to food safety, foodborne illness outbreak investigations, supplier approval programs. There's a broad range that you can follow through with. So there's a lot of opportunity. I'm really excited to hear that you're enrolled in that program, by the way.
And we will make sure that Bridget's contact information gets out in the follow-up as well, so you'll all have access to that. We do have another question that came in through the chat. Is there guidance on takeout food and the containers that they come in?
There's actually a variety of guidance on that particular aspect. And I'm actually part of the advisory board with Restaurant Associates. So they actually had some notes on that specifically. Depending on where you're located, the guidance obviously will vary. So if we go back to March, when we didn't really know a lot about the pandemic, there was a huge shift from the CDC at that time. So at that point, where we didn't have a lot of information, we sort of stopped everything. We were not allowing for reusable silverware in restaurants. Everything was sort of put on hold because we weren't sure how the virus was spread. And then upon further research, realizing that it wasn't spread through food or food contact surfaces, and that contamination through through that method was very, very unlikely, reusable containers were kind of re-allowed in some jurisdictions and not in others. So again, this is a poor example, but in Massachusetts for a long time, we were not allowed to use reusable grocery bags. That got lifted over the summer because there's no risk associated with that. There are a variety of guidance on takeout food and containers. You can access them on the Association of Food and Drug link that is here, as well as the National Restaurant Association link that is posted. There are two different perspectives on that. In addition to that, there's a lot of guidance on continuing carry out, as well as contactless carry out options. So there are a variety of information there. As far as takeout food and the containers they come in, it's up to you if you want them to be reusable or if you want them to be sturdy or durable. Just be mindful that now all of your consumers are ordering takeout from everywhere. So they're going to be comparing your packaging and the ease of use based on your competitor. So be mindful of the consumer aspect as well. And a lot of firms, and I know this isn't technically your question, but it's sort of related. A lot of restaurants and firms have also started doing grab and go meals. So they started packaging meals, fully cooking them or partially cooking them, holding them inside a refrigeration unit and selling them cold to be reheated within the home. Just be mindful of whatever regulations may be in your state or municipality as it relates to that type of food preparation. You may need to have explicit ingredient information. You may need to have explicit reheating instructions to reheat to whatever temperature of that food item within 2 hours. So there's a lot of other information you may need to consider. So again, access the resources on AFTO, NRA, and the FDA has some really good cut sheets as well. But make sure that as you're varying your delivery model to pivot with COVID, that you're still considering additional food safety angles. So here on campus, we very rarely allow students take food home, but because we can't have students eat in the labs, we've had to pivot and create little food safety stickers to remind the students to eat immediately, chill, or discard within 48 hours. So again, just be really mindful of that.
We have another question. Are restaurants required to maintain a contact tracing list? And also, what about temperature checks?
So that's a great question. And again, that's extremely explicit to where you may be located geographically. So temperature checks are not required for guests, but they may be required where you're located for your employees. And the challenge to that is temperature, again, back in March when we didn't know a lot about the disease, temperature seemed to be, the primary factor. But that's because people were so sick that by the time we knew they had COVID, they had already had all these other symptoms. Now we're well aware that asymptomatic people are out there carrying the virus, and they may not have a temperature. They may not have any other symptoms. They're literally just shedding the virus. So yes, it's oftentimes required for employees to have at least a self-attestation that you came to work. When you came to work, you didn't have any symptoms, you didn't have an exposure, you didn't have or confirmed exposure, you did not travel within X amount of days, and that you didn't have a temperature. So that's on the employee side. In Rhode Island, they do mandate that you have a checklist at the host stand that will go through all these symptoms. And as a guest, you're supposed to acknowledge that and self-attest that you are in compliance. And there is the intent to have the guest's phone number or email address that you could trace back if there was any type of potential exposure. In Massachusetts, it's strongly recommended, but it's not required. So again, in the beginning, when we first started dining in again back in late May, we were only doing reservations because we knew at that time, if you made a reservation, we would be able to contact you regardless of how you dined with us, because we knew that you would left your name and number to make the reservation. That has also since changed. The challenge also exists in how you conduct contact tracing. So in Massachusetts, if your restaurant has been found to have a COVID positive employee, it's your responsibility as the person in charge or operator to contact the health department of the town that you do business in and start to support the contact tracing, which can be challenging because if your employee lives in a different community, you may not have all the information available as you start the contact tracing. And as we're doing contact tracing in restaurants, we're more concerned about your employee spread to employee. So if you think about how you guys work or may have worked in a commercial kitchen setting, there's not a lot of room back of house. So even with the facial covering and with the intention of keeping 6 feet apart, there can be a lot of potential overlap. So typically what we see in the restaurant contact tracing is that there are multiple people that will be implicated or impacted. And if you're identified as a close contact, no matter where you fall in that spectrum, if you're a close contact, you also have to quarantine for 10 to 14 days, depending on what the situation may be. And that's where we're seeing a lot of non-compliance across the country, is that people aren't understanding why they still have to quarantine, even if they've had a negative test or 2 negative test results. And the challenge from that is that you can test negative, you can be tested too soon, so the virus may not have begun to shed within your system, so it would be a false negative. Or you could be asymptomatic and not demonstrate those symptoms till day 10, whereas you've still been out in the environment and could have possibly contaminated more people. But by staying in, I call it timeout, but it's really quarantine. But by staying in quarantine for 14 days, even if you have the virus by day 10, day 11, day 12, you're no longer infectious after that 14th day. So we still want people to be really cautious and cognizant, especially in the workplace setting, as we return, hopefully return to more normal. And more information is being prescribed, and the challenge for us here in the Northeast is actually everywhere, is that the guidance, as more data comes in, the guidance is shifting, or as business operators lobby back to the government, the guidance is shifting. So it's really, really hard to stay abreast of all of this. So I encourage you to check in on your state websites for public health, your local websites for public health. And whenever in doubt, just call the health department, because at least that way you're on record that you had that conversation. And it shows your due diligence, because that's really what it's all about. And some other changes that have happened in recently have been historically, or at the rise of the pandemic, as restaurants were allowed to reopen, if you had a positive employee, you were forced to shut down for 24 hours and do a deep clean. A lot of that guidance has since shifted to there's no mandatory shutdown period. You do have to shut down, but you can shut down as long as it takes you to do that deep and thorough cleaning and disinfection. So that really varies depending on what type of operation you're running. So if you're a small, fast casual, maybe you can get through the entire operation in 4 hours. If you're a large dine-in facility with 100 chairs, that may take you a lot longer. So it's really up to you as an operator to distinguish what that may look like.
That leads into our next question, Bridget. Is there a benefit to using certain surface cleaners in both front and back of house as opposed to others? And can you make any recommendations?
There's not really a benefit. It really is dependent upon what you are comfortable with and what you're comfortable on training your employees with. And this is a challenge that we have everywhere right now with cleaning and sanitizing, is that we need to clean and sanitize back of house food contact surfaces per normal. We're not disinfecting those because, again, they're already washed, rinsed, sanitized. They're food contact surfaces. So we're going to do what we normally do for the food code. But high touch surfaces or front of house areas where guests or may sit down, or even like pin pads, you want to use a disinfectant that your employees can tolerate. That's easy. So if you're mixing different types of solutions every 4 hours, or you're creating more work for your employee, you're probably going to see that they're cutting corners. If something is ready to use or is visibly, some firms are using different color buckets now. So we'll see, the traditional red and green bucket, but now some people are using a blue bucket for disinfectant. Just want to make it usable and user friendly for your employees. There's really no one size fits all, as long as it is approved on the EPA disinfectant list. And I'm just going to make a note so that I can share that link with you all as well. So what the EPA did was do a rating and approval of different disinfectants that are rated for COVID. The other concern here, it's not really a concern. I guess the other thing to keep in mind is, yes, you're doing washing, rinsing, and sanitizing for the food code, and now you're doing this new disinfectant step front of house or in restrooms and high touch surface areas. But now your consumers are paying a lot more attention to this. So we have this heightened cleaning and disinfecting protocol because of COVID. And I know it's a lot of extra work, but now consumers are seeing it, and consumers are weighing in on it, and consumers are expecting this. So if you don't have a clearly visible delineated program within your establishment, you may potentially lose guests because they've seen another establishment do something that they felt was better. And it may not be better. It may just look better, which is a terrible thing to claim. But, people are going where they feel more comfortable. So there are some people who love having their temperature checked before they go out to eat, and there are some people who absolutely hate it, and they call it a violation of their rights. It's not fair. But again, you're going to run the gamut on both sides. But this overt sanitation and this overt disinfection is very, very apparent to consumers. So keep that in mind as well as you're designing your protocol, or as you're choosing chemicals. If something smells funny or leaves a strong residual smell, you may lose guests for that as well. So just kind of tailor what works for you, and again, what you think your employees will be able to do correctly, and ensure you're training your employees. If you don't train them well on how to do the cleaning, the sanitizing, and the disinfecting, or if there's an additional rinse required, they're going to cut corners, and you're going to lose a lot of opportunities there as well.
Thanks, Bridget. So we're winding down on the questions that we have here. So if you have any questions for Bridget, please add them to the Q&A. Because we do have a bit of time left in the session. Bridget, one question is, what happens if local rules conflict with national guidelines? Which do you follow?
That happens all the time. And it really depends on the regulatory authority and how it's transitioned. But typically, so I'm going to divert to Massachusetts because that's where I live and that's where I've had a lot of experience. In Massachusetts, the challenge for operators are that there's the national guideline, then there's the state guideline, And then every single Board of Health has the ability to be more restrictive. So you always have to go with a more restrictive protocol. So if, so this has actually happened in Massachusetts. The Association of Food and Drug Officials put out this really nice 4-page document about how self-service stations should be allowed, especially for, say, things like coffee and or whole bulk containers inside of a supermarket, when you can kind of fill your own container, like nuts, candies, things like that. And the Association of Food and Drug Officials, a group of regulatory industry, they came out with this really great guidance document for industry. It was awesome. It was really well done. And I sent it to the state of Massachusetts, and they're like, yeah, we're not ready for that yet. So even though it was the national recommendation, Massachusetts still has decided not to allow self-service coffee or self-service food in bulk containers in any parameter, unless you're like a Cumberland Farms. I have no idea. I don't know if COVID knows the difference between Cumberland Farms and other coffee shops, but that's been the new change, is that you can do it at Cumberland Farms as long as the employee is kind of doling out the cup still. It's very, very challenging, and that's why I caution you, or would remind you all, to have that conversation. If you're in a position where you've seen a national recommendation and your state or local guidance is a little bit different, call the health department, ask the question. It's always better to ask and have that open dialogue than to assume either way. And the other piece that I would remind all of you is that your regulatory inspectors are not there to punish you or create undue burden on you. I know sometimes it feels like it, but they're really there to promote and protect public health. And if you can establish a good relationship with them, it's going to better your entire process. Ecolab has a science certified program with 2 EPA approved products: peroxide surface cleaner, disinfectant, 30-second claim, and a new smart power sink and surface cleaner and sanitizer, 15-second claim. Yes, we have a great relationship with Ecolab here, and we do use the peroxide surface cleaner here on campus with 30-second claim. And so again, whatever chemical you do choose to use, just again, ensure that you're reading that SDS sheet and you're abiding by the contact time. So that's something that we still continue to see as a challenge out in industry and here, is observing that contact time. So if you're using the peroxide multi-surface disinfectant, it has to be on the surface for 30 seconds. And 30 seconds doesn't seem like a long time until you're waiting the 30 seconds for it to actually have that contact time. So just be mindful of that as well.
Bridget, we have a question about food inspectors. Is there a specific frequency in which they're visiting locations? And is there anything like very specific that they're looking for across the board, or does it really differ per location?
Do we know where they're located?
No, but you can use Mass or Rhode Island as an example.
Okay, so before COVID, depending on what food code, so that's the other challenge that I didn't really get into great detail, but depending on what state you're in, you could be on a different version of the food code. So Massachusetts is currently on the 2013 version of the food code. Rhode Island is on the 2017 version of the food code. In these more advanced versions of the food code, there is a stipulation that depending on what type of process you're operating, you may be inspected more frequently. So for example, if you worked in a nursing home, you would be inspected 4 times a year. Or if you were an operation that did cook chill or any type of specialized process, you would be inspected up to 4 times a year or on a complaint basis. Because of COVID, so what happened from like March to June, a lot of states stopped inspecting overall because people weren't supposed to be going down people's businesses at that time, and B, they were asked to kind of stand down as restaurants pivoted to the takeout delivery model and as they sort of adjusted. So a lot of states and municipalities asked inspectors to stand down for a short period of time. It was typically between May and June. Between June and now, a lot of inspections have reoccurred or have resumed. But typically we're seeing that most places are only being inspected once in 2020 because there just isn't enough time, bandwidth, or capacity to do a really full food inspection as well as a COVID inspection. And that's part of the challenge, is that you may see your health inspectors more frequently right now, but it's not because they're doing full food inspections. Your health department has also been tasked and prioritized with following up on all the COVID complaints. So if someone calls the health department or the State Department where you're living or where you're working and puts a complaint against your business, they're obligated to come out and do a COVID inspection. And there's a company called Food Co Pro that actually has incorporated a COVID inspection form into their software. So as an operator, you could actually look for all of the things that an inspector is looking for prior, and that will help prepare you for more success. And they also have really good food inspection software as well that a lot of municipalities in Massachusetts and Rhode Island have started to implement because it just creates a better comprehensive inspection form. So it really varies. We are seeing some states go into a virtual inspection model, and I'm sort of personally on the fence there because if you've never done an inspection of an establishment and you're relying on the operator to bring you through the entire establishment, there is opportunity for, no offense guys, there's opportunity for the operator to not be fully truthful, and you may not see all of the areas that you're supposed to see during an inspection. But there's been different municipalities that have started FaceTime inspections or Zoom inspections, and they would just schedule it. And again, a scheduled inspection is different, but they would schedule the inspection with the owner operator. They would go through and kind of look at those high risk items. So typically employee hygiene, temperatures, sanitation, things like that. So there really is, it's a really, I don't have a great answer for you. I know that right now, most places are only looking at a one-time a year inspection right now. And I will say that based on some of my colleagues that are in regulatory, they're finding that these inspections that haven't been done frequently are way longer in duration because places are just overwhelmed with all of their COVID responsibilities, and they sort of let some of the typical sanitation slip a little bit. So they've been a lot longer of an inspection fairly recently, but anywhere from 1 to 4 times a year, depending on what type of food service.
Thank you. So we don't have any other questions that have come in, but Bridget, do you have any other advice or recommendations for anyone in general before we close?
Yeah, I think it's really important that as operators or people in charge or certified food protection managers, that you do a really good job and you lead by example. If you're the model, be the model. It's really hard to expect your employees to buy into a food safety program if you're not buying into it. So it's not good enough to have a food safety plan. You have to actually follow the food safety plan. And just really be mindful of some of the changes in the food code that have really adapted and addressed the active managerial control component. So now what happens is when an inspector comes into your facility, they may not do anything for 10 minutes, but literally just stand against the wall and watch everything. And what they're doing is trying to see what the tenor is of that establishment. Are people washing their hands? Are people taking temperatures? Is the manager correcting behaviors as he sees or he or she sees them? Because if you're not leading by example or actively managing your employees, it's been proven that your risk of foodborne illness will go up. So just be really mindful of that and be cognizant and try to educate your employees every day on something that either you know to be true or that you have just learned. Having that dialogue and creating and sprinkling in food safety little tidbits throughout the day or throughout any shift will really create buy-in. And if your employees are proud to work somewhere and be part of a really good food safety team, you'll see it in the end result. And your customers will see it. So be mindful of that as well. Our customers right now are so connected. It's 2020. The majority of your inspection reports are online. So as you're striving for business, they're outside looking up your most recent inspection report on their phone. And if they see something that they don't like, even if they don't understand, they may skip by your establishment. Your customers are so connected. With COVID, they're super hyper focused. So you want to make sure that you're doing all the right things for food safety, but also to keep your customers engaged and coming back to your establishments.
And Bridget, I know you serve on a variety of committees and have conversations with colleagues all over the country. Do you have any sense of what everyone's thoughts are on the state of the industry as a whole and the outlook for the future? As you know, I know we're in a bad place with COVID here in a lot of places right now, but once we get beyond COVID a little bit.
I think we're all sort of still gauging and kind of watching. I will say that I see the best success are with people or firms that have really risen to the challenge of COVID and made a lot of that overt sanitation, cute signs that say this table is, shut down for social physical distancing, or different parameters. We'll see a lot more buy-in from their guests. We will see a bounce back. I know that there are people, it will return. Part of the challenge, though, is that people are leaving cities, right? People, and now everybody wanted to be in an urban area, and now because of COVID and homeschooling people under one roof is really challenging. So people are leaving those urban areas for more rural settings. So that will have a temporary setback on establishments, but it will come back. There's a lot of innovation happening right now. A lot of innovation and a lot of great ideas. So this is really an opportunity for you to really make your mark in whatever industry specific sector you may be in. A lot of conversation happening right now about vending machines, which is kind of weird, but that's becoming way more common, is to have vending machines that are stocked daily. They're temperature controlled, they're distributing a fresh prepared item, but there's no consumer contact. It's coming out of a machine, and there's a lot of research being done in that area, both from the consumer perspective, but also in the food safety perspective. And there's a lot of success. So where we're seeing break rooms be kind of mitigated out because of the COVID risk in regular business establishments, some of these vending machines are going in. So firms are partnering with these vending machine companies, and they're putting their proprietary meals in there, and they're becoming, they're getting the name out there a little bit more and becoming a little bit more successful. A lot of catering and grab and go type modeling is happening. There's this huge resurgence in ghost kitchens. There's just a lot of great things happening. It's just different. So we have to figure out what that different is and really pivot to meet that need. Whether it's food safety, whether it's taste, quality, consumer confidence, it's trying to meet all of those things within this unique perspective.
Great. Well, thank you so much, Bridget, for such an informative and interesting discussion. We're grateful to you for sharing your time with us today and appreciate your insight. We'd also like to thank all of our alumni attendees for joining us today. Food safety is just one of the many things that our students learn about in JWU's College of Food Innovation and Technology. CFIT is a landmark interdisciplinary approach to education, meaning we work across areas of expertise to develop creative methods of problem solving. You can help support today's culinary leaders with tomorrow's culinary leaders today with a donation to CFIT. But your gift is more than just a donation. The simple act of giving in any amount actually contributes to the growth of JWU's reputation, our rankings and ratings. Alumni giving is a key metric in the US News and World Report's annual rankings. You can boost JWU's standing by giving each and every year to the university, which increases the value of your JWU degree and makes alumni even more sought after by employers. But most importantly, when we all contribute what we can, we combine our efforts to make a real difference for the students following in our footsteps. That is the power of collective giving. We have included a link in the chat for your convenience. On behalf of our students, I thank you for your generosity. We sincerely hope that you enjoyed today's session, part of the JWU Connects family of programming. Through JWU Connects, alumni can engage in informative and interesting discussions related to professional development topics, as well as opportunities for networking and connection with fellow classmates and faculty. For the full listing of upcoming events, including 2 Thanksgiving-themed events next week, please visit our event calendar at alumni.jwu.edu. Thank you all so much for your time today, and have a great rest of your day.